Hello. Thank you for joining us to learn more about your spine surgery at Sentara. In this video, you will learn how to prepare for surgery, what will happen on your surgery day, and what happens after surgery. We have included information on common spine surgeries so you can learn more about the spine and the type of surgery that is right for you. We will discuss pain management, reducing complications, and preparing your home for your return from surgery. In this section of the video, we will review the anatomy of the spine and review several types of spine surgery. Remember, the surgery your surgeon suggests for you depends on your presenting symptoms and imaging. The spine is divided into 5 regions: cervical, thoracic, lumbar, sacral, coccygeal. Your cervical area has 7 vertebrae, the thoracic has 12 vertebrae, the lumbar has 5 vertebrae, and the sacrum has 5 levels. The levels of the sacrum are all fused. The very lowest portion of your spine is the coccygeal area, and your coccyx has 4 bones that are fused together. The spine is a semi-rigid structure that consists of 33 block-like bones called vertebrae. The spine protects your spinal cord and helps provide you with an upright posture. Vertebrae are the bony building blocks of the spine. Each vertebra has a solid part in front, the vertebral body, and a hole in the back. When lined up, these holes in the back form a spinal canal. The spinal canal serves as a protective passageway for the bundle of nerves that extends from head to pelvis. The vertebral body is the principal weight-bearing part of your spine, and they become increasingly larger from the cervical area down to the lumbar region. The intervertebral discs are located between the vertebral bodies and are made up of fibrous cartilage and act as a spine shock absorber. The outer portion of your disc is called the annulus fibrosus. It is a very tough fibrous structure. The inner part is the nucleus pulposus. The nucleus is what often causes trouble. It can bulge or herniate out and put pressure on your spinal cord or the spinal nerves.
The facet joints are the connections between the bones of the spine.
The nerve roots pass through the foramen, which are openings between the vertebrae. These joints also allow the spine to bend and twist, and they keep the back from slipping too far forward or twisting without limits. Now let's talk about what causes spine pain. Pain can be caused by pressure on the nerve roots or the spinal cord. Conditions include herniated, bulging, or slipped disc, degenerative disc disease, arthritis, spinal stenosis, and more. Spine surgery can be performed from the front, back, or side. Common types of spine surgery are laminectomy, discectomy, fusion, artificial disc replacement, or disc arthroplasty. A laminectomy is the complete or partial removal of the arch of the vertebra, the lamina covering the spinal cord, to relieve pressure on the spinal cord or nerve root. A discectomy is the removal of the vertebral disc to relieve pressure from the spinal nerve or spinal cord.
A spinal fusion creates a bridge between 2 or more vertebrae and provides spinal stability.
A bone graft is placed within the space between 2 vertebrae. Screws and rods are placed to create stability between the 2 vertebrae. Disc arthroplasty is the complete removal of the disc that is replaced by a mechanical device that simulates spine function. Typically done in younger patients, it can help maintain mobility. In addition to your surgeon, your care team includes a patient navigator who will be your primary point of contact and can answer questions about your upcoming surgery. Ask your surgeon's office for more information about how to reach your patient navigator. Another important part of your care team is your coach. A coach can be a family member or close friend who plays an important role in your care and recovery. Coaches provide you with support at home after your surgery and should be available to assist you. Please make sure you assign a coach prior to surgery. We will provide them with the coach's checklist at the hospital.
Another valuable resource is our Patient and Family Guidebook, which you can download online at sentaraspineeducation.com or scan the QR code on screen. The guidebook contains exercises, a medication list, what to expect before and after surgery, and how to prepare your home for your recovery. Review the entire guidebook before surgery, and then use it as a resource throughout your recovery.
Before your surgery, you will need to have a medical clearance exam. This is required before any elective surgery, and the goal is to be sure that any other medical conditions you may have are well managed. This exam can be done by your primary care provider, your surgeon's office, or through the pre-anesthesia surgical screening or PASS clinic. During your medical clearance exam, your past medical and surgical history and your medications will be reviewed. Discuss pre-op instructions with your surgeon's office. Regardless of how your medical clearance exam is conducted, you will receive instructions on when to stop or change medications, like Coumadin, aspirin, non-steroidal anti-inflammatory drugs or NSAIDs like Motrin or Advil, as well as other medicines such as Plavix, fish oil, and herbal supplements. Coumadin, aspirin, and Plavix are all anticoagulants or blood thinners. If you take these medications, you will be instructed by a physician when to stop taking them. If you are taking vitamins or supplements, you should discuss all of these products with your provider before stopping. Typically, you will be instructed to stop taking vitamins, fish oil, and herbal supplements 7 days prior to surgery. Prepare and review a medication list before surgery. Take time to make sure you include prescription medications, over-the-counter medications, supplements, and natural herbs, including patches, creams, drops, etc. on the medication list. You can also check your Sentara MyChart and make sure all your medications are current. It is very helpful to your admission process and direct patient care at the hospital. There is a section in the guidebook where you may write down your current medications. Don't forget to bring your medication list in with you on the day of surgery. You will need to stop taking NSAIDs such as Motrin, ibuprofen, Aleve, naproxen, and Voltaren 7 days before your surgery to prevent increased bleeding after surgery. To be cleared for your surgery, you will need to get blood work. You may also need an EKG, chest X-ray, or other testing. We will prepare your surgical site at the hospital, so please don't shave, clip, wax, or use chemical hair remover on or near your surgical site 3 days before your surgery. That is, your face or neck if you are having surgery on the cervical area of your spine. If you come to the hospital with red, raised, irritated, or broken skin, your surgeon may cancel and reschedule your surgery. We also encourage you to get familiar with your insurance coverage now, instead of waiting until after surgery, so there aren't any surprises. Benefits for home care, equipment, and other coverage vary widely, and in some instances, your insurance may not cover any portion of these expenses. Your surgeon's office is a good resource.
You may also call the Sentara Estimate Line at 757-233-4605.
Make sure you know the procedure code and allow 24 hours for the team to collect information for you.
Don't forget to make a plan for after surgery. Make sure you have transportation home and plans for someone to help you at home for at least the first 24 to 48 hours. These plans need to be made before you come to the hospital for surgery.
The night before surgery, your preparation for surgery begins. Be sure that you remove fingernail and toenail polish. You may leave clear polish on. This is necessary to check for capillary refill and measure your oxygen content using a pulse oximeter. We want your skin to be clean prior to surgery. You will be instructed on how to conduct your pre-surgical cleanse the night before surgery and again in the morning. This shower is part of our skin decontamination protocol.
You will receive specific showering instructions from your care team. Please follow them carefully. You should avoid the genital area and the face. Pre-surgical skin cleansers can cause skin irritation in those areas.
Use a clean, non-cotton cloth or your hands to wash with the cleanser.
When it comes to food and beverage leading up to surgery, eat a regular meal in the evening. You will be given more specific instructions about eating and drinking before surgery. Please review these instructions and follow them carefully. As part of our Enhanced Recovery After Surgery, or ERAS protocol, you may be instructed to drink a carb-loading beverage the morning of your surgery. Please review and follow the instructions carefully. If you have any questions, please reach out to your surgeon's office or patient navigator.
If you are a smoker, do not smoke for 24 hours before your surgery. As mentioned before, in addition to your shower at night, you will also take another shower with the skin cleanser on the morning of surgery. When you get dressed, please wear clean, comfortable clothes to the hospital. All jewelry, rings, earrings, and body piercing must be removed prior to going into the operating room. It may be necessary to cut rings off if unable to remove. Please bring these items with you when you come to the hospital: your insurance and identification cards, a current list of medications,
a payment method in case your prescriptions have a copay,
containers for glasses, contacts, hearing aids, dentures, or any other items you may have. The rule is simple. If it comes off at night and fits in a container, please bring the container. This will help us keep track of your items so they don't get lost or broken. You should also bring comfortable, loose-fitting pajamas, nightgown, or robe.
If you're having surgery on your neck,
a V-neck or button-up style might be more comfortable, so you do not have anything under the brace. While in the hospital, you will wear anti-slip socks for safety. If you want to wear shoes home, make sure to bring a supportive pair, not a slide or a clog style.
Lastly, if you use a CPAP machine, please bring it and know your settings. We will provide the water if your machine requires it.
When you arrive at the hospital on the day of your surgery, proceed to registration first, where you will be directed to the pre-op area. Once in the pre-op area, you will be given antiseptic skin wipes and instructions how to use them before changing into a hospital gown. Your pre-op nurse will review medical history, medications, and allergies, take vital signs, check height and weight, start an IV, and swab the inside edges of your nose with a specific antiseptic solution. You may also receive pre-op medication. You will receive IV antibiotics. Studies have proven that a dose of IV antibiotics before a surgical procedure decreases the potential for postoperative wound infection. Meeting your anesthesiologist is the next step in your pre-op process. They will again review your medical history and past surgeries. Please let your anesthesiologist know if you have any concerns about pain control or have had any previous complications with anesthesia. When your surgery is done, we will move you to the post-anesthesia care unit, or PACU. You will spend time there as you wake up from your anesthesia. Now let's talk about pain management, what we can do to help you, and what you and your coach can do. One of our tools is the pain scale. This is a 0 to 10 scale where 0 means I feel no pain and 10 is the worst pain possible. Please take a minute to look at the pain scale. You will see that 4 means you're comfortable. If pain is keeping you from sleeping, having a conversation, and efforts of mobility, that is level 5 or above. Feeling pain at that level will be disruptive to therapy, so we want to take steps to better manage it. There are different types of pain, and how they are managed varies as well. When you are in pain, describe the type of pain you are experiencing to your care team. Incisional pain is often described as a feeling of soreness or pressure. This is treated with pain medications or ice. Muscle spasm, often described as a tight grabbing sensation that makes it uncomfortable to move, is treated with muscle relaxers, positioning, or bracing. Nerve pain, often described as numbness, tingling, or shooting pain, is best treated with medications specifically for nerve pain. For us to address your pain, we need to hear honestly how the treatments are working. Our goal is to manage your pain instead of letting the pain get ahead of you. Post-op pain can't go away completely, but we want you to be able to eat, sleep, and be mobile. To manage your pain, we use multimodal pain therapy. This means a mix of pain management modalities, such as pain medications and other techniques, like walking and focusing on mobility.
Part of the education you receive in the hospital is about new medicines and side effects. Constipation is a common side effect after surgery from pain medication. Here are some other ways we can help you manage pain.
Ice is a great tool for managing pain. Ask your care team for an ice pack. Continue to use often at home. We suggest you use it frequently in the days following surgery. It may sound surprising, but walking will help to alleviate pain. Staff will be with you when you are standing or walking at the hospital. Walking and being mobile is the most important part of your recovery. No matter how strong you feel, you should never be out of your chair or bed without hospital staff present unless cleared to do so. Our goal is for your recovery to be as smooth as possible. So let's discuss some potential complications and how we will work together to reduce them. Blood clots are a potential complication after spine surgery. Deep vein thrombosis, or DVT, occurs when a blood clot develops in the legs. It can occur during or after hospitalization and can occur in either leg. Signs and symptoms of deep vein thrombosis include redness or tenderness in your calf, a calf that's red or warm to the touch, and swelling or pain in your calf or groin area. Notify your surgeon if you experience any of these symptoms.
Pulmonary embolus, or PE, is a type of life-threatening blood clot.
This happens when a blood clot travels through the body and lodges in the lungs. This prevents the lungs from getting oxygenated blood and nutrients.
The signs and symptoms of a pulmonary embolus are
shortness of breath, chest pain, and feeling anxious, like you know something is wrong but you can't put your finger on it. Call 911 if symptoms occur while at home. You need to get medical attention and a clear diagnosis as soon as possible.
So let's talk about preventing blood clots. Walking and being mobile can help prevent blood clots. We also recommend ankle pump exercises. Let's give it a try now. Put your feet flat on the floor. Leave your heels in place and alternate pointing your toes up toward your head, then point your toes down, pointing and flexing your feet as far as you can in each direction. You should feel the muscles of your lower leg contracting. You can also do ankle pumps while lying down or sitting with the legs elevated. This will exercise your calf muscles and improve circulation, reducing your chances of a blood clot.
Sequential compression devices are used in the hospital on both of your legs. They are a 3-chamber device that wraps around your leg. One chamber at a time inflates to help move blood back to the central circulation. Then they deflate, and the cycle begins again.
You may be started on a blood thinner while you are in the hospital. If you were taking a blood thinner before surgery, discuss when to resume your medication with your surgeon.
Now let's talk about other complications and strategies to reduce your chances of developing one of these after surgery. An incentive spirometer is a device you will use to help open the base of the lungs and prevent pneumonia. We would like you to do this 10 times an hour for every hour you are awake postoperatively, in the hospital and at home. While you are in the hospital, we will also check for signs of infection and monitor your vital signs frequently.
Hand washing is the most important way to reduce the spread of germs and prevent infection.
There are medications available if you feel nauseous or experience vomiting. Your care team will use several options to address constipation while you are in the hospital.
Use these tools when you go home as well, such as taking a stool softener, eating a high-fiber diet, and increasing your fluid intake. These methods will help decrease your chance of constipation. Getting up and being mobile or ambulating frequently will also help prevent constipation.
Now let's talk about preparing for your return home. We recommend you start looking around your home for any obstacles, such as rugs or extension cords that could be a hazard when returning home from surgery. Other obstacles could be the base of a wide chair or legs of a table that stick out. You should also watch for uneven surfaces, floors that are different levels, such as a rug to tile, or other height changes. It's also a good idea to put a night light between your bed and the bathroom in case you have to get up in the middle of the night. Your care team will discuss if any equipment may be needed. If you use a walker, please bring it with you to the hospital. The care team can check it for safety or adjust it for fit. Before surgery, you might also want to purchase a hip kit. This is totally optional, but many find it useful after spine surgery. It consists of 4 assistive devices.
These are a long-handled reacher, long-handled sponge, long-handled shoehorn, and sock aid. These can be purchased at most Sentara to-home pharmacies or online.
Now let's talk about physical therapy and protecting your spine to allow for proper healing.
If you have a step or steps to get into your home or steps to get up to a second-floor bedroom, you will have stair training before you leave the hospital. To help, know how many stairs you have and take note of things like the placement of handrails.
Are they close together, farther apart, on the left or the right, or both? Also think through and plan the best way to get into your house. The safest way may not be through the front door.
Your care team will go over spinal precautions
and show you the correct way to get in and out of bed using the log roll technique to prevent twisting your spine.
Our goal is to get you home safely as soon as possible.
We do this by having you work with a care team member multiple times a day. The number of times you work with a therapist will depend on your progress. We will encourage you to be out of bed and sitting in the chair for all of your meals and any other time you would like to be up, targeting 30 to 60 minutes at a time for the first few days. Frequent position changes and moving around are essential to your recovery. We do want you to rest your spine too. Depending on your surgery, a care team member will assess the need for assistive devices.
Your guidebook includes preoperative exercises. It also includes tips for activities of daily living that you might find helpful both before and after surgery.
After spine surgery, your precautions include no bending, lifting, or twisting. With the cervical spine, you should practice optimal body mechanics by keeping your chest up, shoulders back, and abdominal muscles tight. This helps maintain a neutral spine position and reduces stress on the spine. Your precautions are the same after lumbar spine surgery. No bending, lifting, or twisting. Again, it is important to practice optimal body mechanics to help maintain a neutral spine position to reduce stress on the spine. Keep shoulders in line with hips. To look behind you or to the side, you will want to turn your entire body. You will practice the log roll technique before going home. This technique will protect your spine and prevent you from bending, lifting, and twisting. When you are lying on your back, you will start by bending your knees, then roll onto your side, keeping your hips, shoulders, and ears moving together to avoid twisting.
From this position, you'll push up from the bed using your arms while simultaneously swinging your legs over the edge of the bed and then rest your feet on the floor. To return to bed, you will repeat these steps in reverse.
Once your surgery is complete and your care team feels you are ready to leave the hospital, it's time to transition home for the rest of your recovery. We encourage you to be open about how you are feeling and what challenges you may be having. Understanding this will help us better connect you to resources and even help manage your pain so it doesn't keep you from doing your exercises, attending physical therapy, and simply staying mobile. We are a team working together for your recovery. When it's time to go home, please make arrangements for transportation from the hospital. Ambulance transportation is not a covered service when you are up and able to walk after surgery, so you will need to find another means of travel. We recommend the front seat is pushed all the way back to give you more legroom. To help you get into the car safely, back up to the car until you feel the seat at the back of your legs. Reach your hand behind you for the back of the seat, using the other hand to secure a spot on the frame of the car or dashboard. The car door or walker are not secure options. However, if you need to use the car door or walker, have someone hold the unsteady objects. Slowly lower to a sitting position. Scoot your hips back until you are securely on the seat. Leading with your hips, bring one foot into the car at a time until you are facing forward. You may want to recline the seat to increase the ease of lifting your legs. You can also keep the seat slightly reclined while you are riding in the car if it is more comfortable for you. An ongoing mobility or walking program will continue to be an important part of your recovery. The type and duration of therapy services after surgery will depend on many factors. Let's talk a bit more about caring for yourself at home and what's more important for your recovery. First, read all your discharge instructions and have your coach read them as well. They will include your medication schedule, what to take and what not to take, bath and showering instructions, and information about your surgical dressing. You should have someone who is able to assist you for at least the first 24 to 48 hours. Make sure you're taking your pain medications as instructed. Remember, we want you to stay ahead of the pain. We suggest that you get up every hour during the day. This increases circulation to reduce your risk of blood clots and exercises your lungs and helps with pain control. You will recover faster if you eat healthy foods. If you have a smaller appetite, we understand, but we ask that you still eat small amounts of healthy foods and hydrate. You will increase your walking distance over time. We suggest that you set a schedule and goals so that you can measure your progress. We know that this is a lot of information. That's a big reason why we created this video, so you could review it at your own pace and as many times as you'd like. Your patient and family guidebook will continue to be a great reference. And as always, if you have questions or concerns, please reach out to any member of your care team, especially your patient navigator. They are there to answer questions, calm your nerves, and help ensure you have the best experience possible.